Hello, everyone, and welcome. Thank you for joining. We will be starting the webinar soon. All right, thank you, everybody, and welcome. Good morning and good afternoon, depending on where you're joining us from, and welcome to Opportunities for States to Align Policy and Data to Drive Systems Change. Next slide. My name is Carlise King, and I'm the Executive Director of the Early Childhood Data Collaborative at Child Trends. And I will be facilitating today's conversation with our panelists. And I'm really excited for the discussion today and the opportunity to share these perspectives with all of you. I did want to take a moment to just acknowledge and thank our Early Childhood Data Collaborative project team you see here on the screen, as well as our communications staff who helped to make today's webinar possible today. This is always a truly collaborative process, and we deeply appreciate everybody's contributions behind the scenes. My colleague Dale Richards, who you see right next to me on the slide, is also on the call with us today and will be helping to facilitate the questions that you guys have throughout the discussion. So, and during the Q&A section that we'll have after the panel discussion. So please submit all of your questions and comments that you have throughout the webinar using the question and answer box. And then finally, I'd like to thank our funder, the Gates Foundation, whose support made today's conversation possible. So before we get started, I want to share a bit about the Early Childhood Data Collaborative and sort of why we're hosting this conversation today. So the Early Childhood Data Collaborative, or ECDC, as I'll refer to it for the rest of the presentation, is an initiative within Child Trends that's focused on coordinated early childhood data systems and supporting the accessibility and use of data and research to help guide policy and program decisions. Our work focuses on research to help states and communities strengthen data infrastructure, governance, and data use to support stronger early care and education systems, workforce supports, families' access to early learning programs, as well as their experiences, and to ultimately have inform better outcomes for children and families. As you'll see illustrated in the graphic on the right, young children and families often interact with multiple early childhood programs, which are often across health, education, and human services. These systems each collect important information, but too often we're finding that these data remain fragmented and disconnected. So by coordinating early childhood data, that helps bring these pieces together to create a more complete understanding of the needs, experiences, and outcomes of children, families, as well as the workforce that supports them. So we often work nationally with policymakers, researchers, and systems leaders to identify emerging trends, challenges to understand what are effective strategies, as well as opportunities across the field and to share tools and resources to support improved data collection and use. One of the key things of our work is that effective early childhood data systems must be driven by policy and programmatic questions leaders are trying to answer. So rather than building systems that are purely for compliance alone, leaders are increasingly focused on developing coordinated infrastructures that can inform decision-making, identify service gaps, and support improved outcomes for children and families. So today's conversation will be exploring several of these key issues and opportunities that are currently shaping the field. This conversation is especially timely because we know early childhood leaders across the country are navigating a rapidly changing policy landscape, working to streamline these complex systems. And the fact that families rely on multiple interconnected supports like childcare, preschool, home visiting, and Head Start, they're really looking to data and research to help guide how to make sure that families that are eligible to these programs are getting access to them, improving the coordination of services that families receive, as well as making sure that populations that are being underserved are being reached. At the same time, leaders are also facing challenges with fragmented data, workforce shortages, funding pressures, policy uncertainty, and addressing uneven access to supports. So, for today's conversation, we want to focus and share examples from experts in the field on how data and research can help drive systems change and examples of where that's happening. And then, more specifically, thinking about how states can better partner with policymakers, respond to critical workforce needs that we've been hearing repeatedly states are struggling with, as well as ensuring that family voice is reflected in the policy and systems designs that move forward. There are areas many states struggle with as they continue to balance limited resources with growing program and policy demands. For example, we hear states are trying to better understand workforce shortages and turnover. They're trying to identify where families face gaps in accessing care, as well as trying to determine how they can coordinate services across systems effectively. The goal for our conversation today is to highlight practical strategies and lessons emerging from the fields that can support this work, as well as resources and opportunities and experts like our panelists that will be helpful to leaders along their way. We also see this conversation as the beginning of an ongoing dialogue and an opportunity to bring together state and local leaders to share how they are developing and strengthening their use of early childhood data. And as part of this effort, this is part of a series, and we'll be posting a second webinar in September to continue this conversation with state leaders, sharing specific examples of how they're doing this how they're building their infrastructure and coordinated data in their state. But that is sort of why we're here, and I want to move to our conversation for today and our speakers. So I'm excited to introduce our panel for today, and I want to thank them again for taking the time to share their expertise on this topic. And I'll begin briefly by introducing each of the panelists, and then we'll move right into our discussion. So please feel free to share, again, any questions or comments that you have in the chat. We've set aside about 20 minutes at the end of the presentation for audience questions. So first, I would like to welcome Dr. Leah Austin, who is a nationally recognized expert on the U.S. early care and education system, as well as workforce. With more than 20 years of experience, her work has focused on workforce compensation, preparation, working conditions, and advancing racial equity in early childhood systems. She is also widely recognized for creating spaces that center learning from, with, and in support of early educators. Prior to founding Equity in Early Ed Systems Reform, Dr. Austin served in a leadership role with First Five, Alameda County, Mills College, and as the executive director of the Center for the Study of Childcare Employment at UC Berkeley. She has also generously served as a member of our expert consortium that provided guidance and input on the development of ECD's Step Forward with Data framework. Today, as founder and principal consultant of Equity in Early Ed Systems Reform, she works to advance policies and systems that strengthen and sustain the early care and education workforce. Leah, thank you so much for joining us today. Next, I'd like to introduce Christy Carmen, director of the Rapid Survey at the Stanford Center on Early Childhood. Since 2020, Christy has led a research team administering national, state, and community-based surveys designed to better understand the experiences, challenges, and resilience of young children and the important adults in their lives. Through Rapid, her work focuses on making timely and actionable data available to inform policies and programs that support thriving children, families, and communities. Prior to going to Stanford, Christy spent 10 years conducting health policy analysis and research in Massachusetts. We're so happy to have you here with us today, Christy. Thanks for joining us. And last, we have Elijah McCabe, who is the Special Assistant to the Chief Policy Officer at the National Governors Association. Previously, he served as Senior Policy Analyst at NGA's Center for Best Practices, where he supported early childhood and child welfare policy and worked closely with state and territory leaders to advance strategies to improve outcomes for children and families. Prior to joining NGA, Eli worked with the Administration for Children and Families and in the office of Pennsylvania Governor Tom Wolf. For the last year, Eli has supported state and territory leaders in advancing early childhood priorities through systems mapping, governance reform, and strategic financing. Welcome, Eli. Eli, I would like to kick off our conversation with you with our first question. Right now, as we mentioned, states and territory leaders are and advocates are navigating rapidly shifting policy landscape. In your work, what are some of the top early childhood policy priorities you're seeing governors are advancing right now? And what data do you see as most critical to support those policy priorities?
Yeah, absolutely. And again, thank you to Carlise and team for the opportunity just to be on this webinar and to be among great company. Those were some impressive bios. So just excited for the conversation today. I think from our vantage point, we're releasing three priorities bubble up to the top of the ECE space. And those being accessibility and affordability of care, governance and system consolidation, or governance and system consolidation, and then workforce stability. I think are the really the three that we're seeing. So on the affordability and accessibility piece, we saw several governors bring up in their 2026 State of the State addresses, or the early care and education, with over half of them talking about the high cost of childcare and the financial burden on families. And we really see across the board, this is a bipartisan issue, really especially framing ECE as this economic infrastructure tied to workforce participation and then real broad affordability. I think the second priority that we're seeing a ton is governance and system consolidation. So I think a lot of governors are recognizing that fragmented systems really can't deliver quality early care and education. I think, we've seen several states make the move to a single cabinet level agency for early childhood, and others are dedicating offices specifically to coordinate that ECE delivery across the state. And we know there's not one silver bullet that really is a fix for this, but we've seen states kind of take a couple of diverse approaches to that system consolidation and system mapping. And we just last fall released a brief commentary from our Governor's Education Policy Advisors Institute, kind of talking about this issue of system, mapping early childhood across the state or territory. And I think potentially there's going to be a link in the chat to that resource, but happy to put it in there if not. And then I think that third priority, workforce stability, looking at compensation pipeline, retention, which really continues to be a binding constraint to that first priority of access. And we saw during the pandemic, governors were leveraging a lot of their COVID dollars to support the ECU workforce, but with tighter fiscal conditions now and a lot of those dollars sunsetting, investment in workforce is really ever critical to support those three priorities. And then thinking, when thinking about this question, thinking about the data side of it, what data is most important to support these priorities. I think supply and demand data, so looking at childcare deserts, slot capacity versus need, but by area, I think is really important. Thinking about cost and affordability data, I think looking at the true cost of care, what families are paying, as a share of their income. Workforce data, again, really to that last point, wages, turnover, credential pipelines. And then I think two of the most important, when we're framing early childhood investment as economic infrastructure, is looking at like utilization and outcomes data. So especially tying that to state-funded programs, looking at kindergarten readiness, and then thinking about ROI data and connecting early childhood spending to workforce participation, tax revenue, and K-12 outcomes are kind of some of the top line data that I really, thinking about those three priorities that we see bubble up that could be really useful to governors and their policy staff.
Thank you. And I think we're going to be touching on all of those issues today. Leah, uh, we've repeatedly heard that workforce challenges remain a top priority. And as Eli was just saying, for the governors as well, how can workforce data best be used to drive systems change? And from your experiences, how has the availability or the absence of workforce data shaped kind of conversation around workforce needs and advancements?
Yeah, well, I'm happy to jump in here and just thank you, Carlise and the team for having me as well in this conversation. I'm always glad to talk data, but I also think we've seen so much progress in the last number of years in states collecting and utilizing data that we have more things to point to, more opportunities and examples than we did a handful of years ago, which I think is definitely exciting on this front. And at the risk of repeating what Eli said, I want to just start and say connecting the dots in data is really, really important to making the case for systems change and policy investments. And there's many dots that we'll talk about today that are really important. Um, and you'll probably hear me say this again too, but making data public and making data easily accessible. So just like let's hold those principles as we're going through our conversation today. Um, I also think it's really important you asked about like, what's the impact of the absence of data, right? And I think that is important to talk about because we can't course correct or intervene or appropriately support what we can't see. So the absence of data, good data about early educators, leaves us sometimes kind of wayward, right? With decision making that can be driven by assumptions or sentiment or beliefs, but not necessarily reality, or that might be driven by, um, some average data point, but doesn't actually tell us, well, what's happening within that. Like everybody's not average. It's why it's average. There's people here and there's people here. So having data across our workforce to understand what is happening, how does that look differently? Do we see, stratification? Do we see inequities in what people are experiencing? How how they're experiencing their well-being, and are there patterns to these are all really important questions that states should be able to answer, and I think we increasingly hear policy leaders want to be able to answer, right, so that they're moving forward with policies that are driving inequities that may already exist. Have to have those data in front of us. And, we are still learning lessons from COVID. It seems like we get further and further away, but we are still learning those lessons. And one of those was what happens when we don't have good data and there's an absence of data. When the crisis hit, many states and local communities could not answer some fundamental questions like how many people make up your ECE workforce? How are they geographically distributed? Um, while we had national data that helped drive the real, historic levels of federal pandemic relief, states, many, not all of them, but many states kind of stumbled when they got those resources because they lacked the data and infrastructure to even know, like, well, how far is this funding going to go? How many people can we reach? Can we get people that are already in our subsidy system? How do we find them? What do we know about them? And I think that has moved data collection faster than we were seeing before. If we look at the Center for the Study of Childcare Employment puts out their Early Childhood Workforce Index, and workforce data is one of their 5 policy areas. And if you look at 2016 or 2018, most of the states for data collection were like red or yellow, which means like there's a lot of work to do there. And if you look at them now, there's still work to be done, but most of the states are green across the board. And so folks have invested in that. They're starting to connect the dots. We've seen states that are really different from each other, or communities. Kentucky used their workforce data to make a decision, um, at one point that their early childhood workforce would be a qualified category for childcare subsidy as a financial relief for their workforce. They were able to figure out how much that was going to cost them because they knew their workforce and they were able to answer that question. We kind of can move over to California. We have a county, Riverside County, that was very intentional in recognizing they didn't have great data. And as they were moving forward with a stipend program, they wanted to use that to collect better data, to inform future planning as well, and look at their own infrastructure, right? Those connecting the dots, connecting data, collecting data about their workforce, the impact of their stipend, and using that to say, well, who are we reaching and who are we not reaching? And what does that say about our capacity and infrastructure so that they could build that and going forward and really taking a more holistic approach. So all of that to say, I think having the data, having it in real time is really critical, and having it on an ongoing basis so we don't have just a snapshot that maybe is from a handful of years ago, and using that to make decisions about the workforce, but also the infrastructure that is responsible for supporting the workforce and also often getting things to people, right? Resources, professional development, funding, and knowing what their capacity is.
Thank you, Leah. And I'm glad you point to the progress that has been made, because I think we're always focusing like how do we address the gaps and gaps. But I agree, we've definitely seen improvements. And I think both you and Eli bring up COVID and like how that was a catalyst in many different areas, which brings us to our last panelist, which the rapid survey that came out of COVID. He'll talk a little bit about that, which is designed to provide frequent and actionable insights, as well as elevate the voices of families and providers. Christy, could you share a little bit about the rapid survey and how having regular ongoing data has helped deepen the understanding of families' needs and how this has helped shape kind of inform policy and system responses?
Yes, absolutely. And thank you also from me to Carlise and the Child Trends team for organizing us today. And I'm grateful to be sharing space with Leah and Eli. And just to echo both of their remarks already, I think I can tell already there'll be a lot of themes across what we have to share today. We frequently hear on Rapid that decision makers are trying to address childcare supply challenges, all the things that have been mentioned so far and more, without really knowing a lot about demand. And now also because of some of the progress that's been made in recent years, they're also wondering if the big policy wins in some places are really improving family and caregivers' lives and fulfilling the promise of those policy wins. So rapid surveys are one tool that can be used to understand family and caregiver experiences. So their overall well-being, their economic stability, what's helping them, what their preferences are for the systems and supports that they rely on, and why, what's behind those preferences, to really understand and meaningfully connect to what families say will support them best. And it's important, as Leah just mentioned, to gather these perspectives and information from families and caregivers, not just once, but frequently in an ongoing way, to capture and document both those snapshots and important moments in time, but also changes over time, because family life is dynamic, our economy is dynamic, circumstances are dynamic, and there is change, especially when we're talking about wins and progress. We want to be able to keep our eye on what's working and why, and understand that experience for families over time. So centering family experiences, really actively engaging with what parents and families and caregivers of young children say they need, what they want, what serves them best, leads to better informed policy and decision making. I think we're all probably have heard this often used phrase, everyone depends on someone who depends on childcare. And it can be easy for decision makers, we know, to be in their work, in their important roles without really recognizing or appreciating where in our economies, in our communities, in our family life, people are dependent on access to childcare. So really elevating family voice and caregiver voices and experiences helps to remove those blind spots from our systems and our processes that develop those systems. So to be really specific and concrete, timely, actionable, ongoing family and caregiver data can inform real-time policy and program decision-making and guide that work at the state and local level. It can document how families and caregivers are experiencing new policies after they've been put in place to really understand if and how we're achieving the program and policy goals that we set out to achieve. And additionally, it can be used as an advocacy tool to build the case for policy solutions that are still needed, or bolster the defense of existing policies and investments where they've been put in place but need to be secured for the future. And lastly, can be used to educate and build understanding among lawmakers. So there's a lot of data from Rapid and from other sources highlighting how childcare providers and families and caregivers of young children are experiencing a lot of uncertainty, financial insecurity, stress. And so they're understandably focusing on getting by and not necessarily running for office. And so, of course, there are some amazing examples of this. And I'm thinking of US Congresswoman from Colorado, Brittany Peterson, voting on the House floor with their infant in our arms. But generally, our experience has been that our leaders aren't always reflecting the caregivers and parents that they're serving, and there can be an empathy and an understanding gap. So it's incredibly powerful to build systems and channels and tools that powerfully lead to caregivers and childcare providers and families speaking for themselves. And we hear from our colleagues in policy and advocacy that this education and this understanding building is a key part of cultivating change now and also building legislative champions for early childhood in the future as well.
Christy, I think we've been putting some examples that you shared in the chat, but I think moving kind of our next question we wanted to hear from you all about is like, what are some promising innovations you've seen in using kind of your family survey data or any types of family survey data, and what have kind of been the outcomes of utilizing that family survey data?
I really appreciate this question and appreciate you asking, and I could speak at length on it. But for the purposes of our brief time today in this conversation, I'll focus on one, and then really welcome any outreach about other examples from folks in the audience in the future. But for today, I really want to focus on a partnership with an organization called the Connecticut Project, which is in Connecticut. And we've been in partnership with the Connecticut Project since 2023. And they've brought together other key stakeholders from across the state and communities and localities, but also at the statewide level to work on a project with the Rapid team to design and implement parent surveys over the course of 2.5 years now. So we've been in partnership during that time to co-design 8 parent surveys that were designed to be fielded quickly, sort of designed and quickly implemented, which is a style of research that Rapid really embraces, to gather ongoing data, so 8 times over 2.5 years, with each survey having a topical focus that would help fill data gaps in their system building work and their advocacy and policy advocacy work, and allow that Connecticut team of on-the-ground stakeholders to hear directly from families across the state about policy priorities that were designed to, these priorities are targeted to supporting families' economic well-being overall, with childcare being a major focus of that. There are a couple of characteristics of this partnership and this project and the way it's been structured, primarily through our Connecticut project and the groundwork that they laid to be able to bring to our complementary tools that we can provide as Rapid. That I think are really replicable in other localities and states as well. So the first is strong buy-in and collaboration across the project team across the state, both people looking from roles at the statewide level to other localities and community-based organizations, just really strong buy-in, including with an organization called the CT Data Collaborative, whose mission is to make data accessible, as Leah mentioned, and to support data-driven decision-making in the state. The second is financial investments from the funder, which is in itself a state-based funding organization. And they supported with investments to CBOs across the state to support those organizations in doing outreach to parents about the survey, the opportunity to take the survey, and then about sort of making meaning of the data and feeding it back into communities. And so the result of this network of local CBOs that the funder invested in is that the data and the parent stories are reflecting the experiences of parents across the state. And it has built engagement from organizations across the state in this parent survey initiative over the last 2.5 years. And then the third piece I'd point to success of this partnership is that the Connecticut project has regularly shared that data back out through routine briefing calls with partners and stakeholders statewide. So to share with parents and CBOs and other stakeholders what parents are telling us through the survey, how it's aligning to the policy work happening at the state, and what action is being taken given what they're learning through the survey. So it's been an incredibly rich learning experience. Two outcomes of the project so far that I want to highlight is one is the CT Data Collaborative has created a really robust publicly available data dashboard that includes this parent data that's come through the Rapid Connecticut surveys. And they're going to continue to add to that as our partnership continues through 2026 as well. If it hasn't already, a link to that dashboard will be popped in the chat. And then the second is that the Rapid Connecticut surveys, the parent data coming from those surveys has informed statewide advocacy, led in part by our Connecticut project team members, for investments in childcare and economic support to families, contributing to really important policy wins in 2025, which I'm sure that many on this call will recall, the Senate Bill 1 and House Priority Bill, which, among a variety of measures, established an early childhood education endowment for long-term state investments in early childhood, and it caps childcare costs for families to increase access to childcare and affordability and reduce the financial burden. So overall, our partnership has been described by our partners as movement building for their work in the state's early childhood policy and advocacy work, and we see so much potential for similar state and local initiatives to incorporate this approach to bringing in family and caregiver data into their policy and advocacy.
Thank you, Christy. I think, Leah, coming back to you, I know you shared some examples from California and Kentucky. Are there other examples of key successes or drivers you've seen that have sort of helped in shaping some workforce policy efforts?
Yeah, and I am going to come back to California one more time. I know California is a big state, but I also think there's some good lessons learned in some of the workforce data efforts that are happening there. Um, and I think so I'm going to, kind of touch on some examples lightly, but I think the key theme I want to emphasize here is publicly available and accessible data that is very easy for people to put their hands on it and use it in whatever varied advocacy and policy making context they're going to need it in. So data that educators can access, it's their data, it's about them. And so making sure that educators have access to it, making sure that legislators, probably really legislative staff have access to it. Um, and that it's easy to interpret and figure out like what's happening, who the data reflects and what's the meaning behind it, really helping people do that meaning making of the data. I remember being in a meeting with federal staff a few years ago at this point, and we were kind of asking this question to them about research and data and like, what do you want? How do you want it? What's most effective? And they were like, please do not send us reports. Do not, like, we're not going to wait through all those reports. That's just not how many people are functioning in their day to day. And it was like, give us the takeaways, give us the things that we can put in front of legislators that they can, look in a couple of pages and really understand like what is happening in their states or their communities. So, um, think we can't emphasize that enough. It doesn't mean that we're like taking anything away from the data, but I think, actually making it more impactful if we can make it really accessible to folks. I think that the Rapid Survey does a really great job in their resources of doing that and pairing quantitative and narrative data together. I think the Center for the Study of Childcare Employment is doing a really good job of this as well. And so one example I wanted to point to, so folks can look at, is something that this Center for the Study of Childcare Employment put out last fall, and I think we have a link to it. And it's got, I think it's 8 data points on the workforce. And so anybody can go to that, or the workforce in 8 charts, I think is what it's called, can go to that and say, oh, this is what we know about education and experience of the workforce. This is what we know about how that is distributed across the state. This is what we know, we can see very clearly, like this is a very educated, experienced workforce that totally doesn't match the pay that they're receiving. We can then see the impact because there's information about well-being. It's challenged. And so having data like that people can pick up, I think is really important. Um, a resource I don't think I shared with the ECDC team in advance that we could drop into with the Early Childhood Workforce Index that I mentioned also has like state profiles that are easily accessible. And so, we've seen advocates across the country take data that's again easily accessible and be champions of that. Keep bringing that to their legislators, use those data to educate them and make those direct connections to, so what does that mean for our policies and investments? How do we again connect those dots to this is what's happening with the workforce? So not surprisingly, this is what's happening with families and employment and the state and local economies. I'm sure there's folks on the call who know Massachusetts much better than I do. But I think data has been a really important part of the Massachusetts study over the last decades, with advocates really educating and bringing data to um, their legislative champions and helping them get their hands on it. And what we've seen in the last couple of years is you know, those champions like showing up with the data to themselves, bringing that to the state house, to the floor, and being the ones, or being someone to present a data chart or something about the workforce and making the case for investment. And that to me feels like such a great win, right? That it's not always somebody else having to be a spokesperson, but really getting data in folks' hands. And having data that helps us see, again, those disparities. We've seen this in New Mexico. I know New Mexico we talk about a lot, and we should because they're doing really interesting things there. But one of the things that they did was have a targeted infant toddler wage initiative because their data showed disparities across their workforce in terms of infant toddler teachers being paid so much less than their preschool teachers. Um, and so, they were able to, in their strategy to move wages for everybody, say we're going to have a targeted start because we know these gaps are especially severe. And so I think again, having the data that's accessible and being able to see beyond the average, right? If we're looking at the average and just making a change, if we're saying everybody's going to get, you know, $5 more an hour, great. We want people getting more, pay, better compensation and benefits. But if we're not using the data to understand how that looks differently, we're kind of just moving everybody, but maintaining those disparities. So I think having again the data, it's publicly accessible, it answers really critical questions. Um, and I think again we've seen that play out in Massachusetts and New Mexico. Um, North Carolina is another place that has really good workforce data that's easily accessible, that also looks at some of those disparities, and they're able to bring those conversations to, again, the state house on how do we target, our strategies at the same time that we're moving toward something that's better for the workforce and the system as a whole.
Thank you, Leah, and thank you, Christy. So we want to make sure that we get to our Q&A, but Eli, I think what we're going to have you do is also share with us, because I know one of the priorities that you had talked about around the governors was governance, right? And we know that strong governance and consistent funding is needed for a lot of the systems change that folks are trying to do. Can you share some examples of key successes and drivers you've seen in governors' use of data and research to help strengthen governance structures, secure funding, as well as expand access to supports as they advance these priorities? And then I know we wanted all of you to share kind of key action steps. So I think if yeah, you can kind of share some of those key drivers and examples you've seen, and then kind of a few action steps for folks that want to partner with their governors in their states around some of this work. That would be wonderful.
Yes, I'm a fast talker, so I will try to get through all of this. But yeah, I think yeah, definitely, and I will probably repeat what Leah just said. I think New Mexico is a great example of really using data to consolidate all of that ECE programming into a standalone agency, and I think they've seen some great results because of it. Reduction in administrative duplication, really improved alignment across their state administered systems. And then just an overall streamlined governance structure. I think, Christy also mentioned Connecticut. They set up their early childhood education endowment. So kind of a twofold, really consolidating their governance system, but also securing state funding. And I think we saw a ton of use of data in that. And I think I also just want to mention and give a shout out. I think Georgia is another place that has a really, really strong data um, that informs a lot of their state funded programming. And so I think what a lot of these states that are really using this data to consolidate their governance systems and secure funding and expand access. I think on the governance, using data to really look at duplication and delayed services and the inconsistent outcomes across the early childhood sector, I think really makes that case for the consolidated governance piece. I think on funding, we've seen a lot of real strong success stories with pairing the investment with an evidence narrative. So thinking, using data to actually tell a story and connect these outcomes with a lot of what we've been talking about thus far. I think states that could really build a credible data infrastructure were able to secure a lot more funding and invest in a ton more of their programs. And then on the access piece, I think one of the key drivers has really been connecting early childhood data to workforce and economic data. I think I mentioned this earlier in kind of some of the top priorities, but I think when we align ECE with workforce participation, economic infrastructure, it suddenly there's like a dollar sign next to this investment rather than just social spending, which I think is sometimes more appetizing to legislators, to policymakers. And so when you're able to kind of really show that clear return on investment to the legislature, I think there's a lot more appetite for funding. And so I think really the common thread across all three is that, governance, data, funding, they're not all of these separate work streams. I think the states that we've really seen succeed in a lot of this have built them together and they've used kind of the different pieces to reinforce the others. And then I'll move on kind of the action steps, which actually I think we've already really talked a ton about them. Um, I think number one is really leading with the policy question. So, like Leah mentioned, if you're throwing like a 40-page report on a governor's desk or a governor's staff desk, more likely than not, that is not going to get read because there's just not enough time in the day. We're competing with hundreds of priorities. And so when you lead with that policy question and you're able to just very succinctly kind of present one or two key data points that inform that policy decision or that legislative priority, budget choice, federal opportunity, whatever it is, I think that makes a really strong case, a really strong use of the data. So really shaping the product around the decision, not the bulk of the research. I think secondly, what we've seen a lot of states, and this specifically is more of a best practice in states, is we've seen a lot of states establish a chief data officer who kind of acts as that translator for the data. So that they sit at the nexus of the agency and the governor's office, and they're able to make sure that the data isn't getting stuck in the agency, but that it's also being translated well to the governor's office and vice versa. So that decision-making process is streamlined in a lot of states that we've seen really stand up this CDO position or a position similar to that. I think third, and this is another one that I know we mentioned today, is really building community input into the data. So being at the table when these decisions are being made, leveraging the voices of community stakeholders, parents, providers, local leaders, when gathering this data, and making sure that the way it's presented is actionable for them. I think we can throw a dashboard on child well-being up on a state website, and it's sometimes difficult for families to understand. So having that family voice to make sure that the things that they're seeing and the data that they're consuming is useful for them. And then I think this is another one that, both Leah and Christy have talked about, is really investing in like visualization and the narrative around the data. And I said it during our prep call for this webinar, but I'll say it again. I think the rapid survey is just a fantastic example of like very easy data to consume. And it's also just visually appealing to look at, which is sometimes half the battle. So I think a well-designed dashboard or a very clear infographic. We were just down in Charleston a few weeks ago for a project on K-12 data systems, and Rhode Island shared a few videos that they had made on chronic absenteeism, and I thought it was just so powerful, so useful for that 1.5 minute video just to talk about this very kind of complex topic to really distill it down and make this data that they had very visually appealing, number one, but also just easily digestible for the average person. So those are my recommendations, best practices, so to speak.
Well, thank you guys. And we'll give an opportunity for closing comments, but I think we do want to open up for some of the questions that we received through the registration, as well as the ones that Dale has been tracking through the chat to come back. So, Dale, do we have any questions that came up?
We do. We have a couple. The first one was just any specific tips for states such as Illinois, as an example that got brought up, to combine agencies into one early childhood agency and one data portal, which is a pretty big question. So if you have some initial thoughts.
And do you guys let us know if you need the question repeated? And I'm not sure if you were talking about consolidated governance structures. I know Eli earlier, if you had any sort of good examples or approaches that you've seen or heard.
Yeah, I mean, I'll definitely just plug that resource, Mapping the Early Childhood Education Ecosystem. We actually recorded the session at our Education Advisors Institute. So there's about an hour-long presentation panel that we can go back and watch that kind of talks about Jenna Conway, who's in Virginia, but also did this work in Louisiana, kind of talked through some of the best practices while she was doing this work. So I think that would be a great resource to kind of start with.
And then we have oh, did you want to go? Okay, we have
No,
another question that came in. I'll just read it out. Is part of the value of publicly available data that it forces legislators to look at the evidence for problems we all generally understand exist? It doesn't seem like the absence of data, for example, is the reason early educators don't get paid well, but perhaps if they are confronted with the extent of the disparity, legislators are more likely to act.
Leah,
Yes,
Mhm.
I would say yes, that's exactly it. It's not that, although there are still some communities that don't have great data, that allows you to drill down on what that looks like across communities. But yes, we know very clearly, the status of pay across the board, but it is that like making it visible, helping get it into people's hands that aren't just us who are usually doing this, right? And being able to pose those questions. There's another great resource I can drop in here called the Justice Toolkit that I worked on with my colleague Hopeton Hess last year at the Center for the Study of Childcare Employment. And it lays out like 10 questions to pose, whether that's to, legislators or other leaders, or even, of our own work and how we're using information, who we're including, and, coupling that with the data and putting those questions forward, I think are really critical. It's like, if the absence or the lack of visibility allows the status quo to persist, then the visibility in having it allows us to present that challenge to the status quo, and hold folks accountable for answering to the data that are in front of them and helping to identify what is that roadmap or roadmaps for change.
Great. And then we had another question come in from the registration. So we probably have time for this question, and then we'll need to move on at the end. How do we gain back trust in data, evidence, and research among the general public and with policymakers?
Do you want to take a first stab at that one?
I can. One of the things that is the theme in my remarks here is around sharing data back to those who provide it. So it's a strong value of Rapid and other researchers and organizations as well that on the other hand, there's quite a lot of data collection that happens where it goes into sort of a black box or, is totally inaccessible to those who have provided it, and they don't know how it's been used, if at all, in decision making. So that contributes to fatigue in providing meaningful engagement and providing data and information, as well as overall sense of a lack of trust that the data is used. So really reinforcing, creating strong feedback loops and reinforcing those feedback loops so that those who are providing this critical data and information understand why it's being gathered, how it will be used, how it is being used, how it's influenced decision making, and include them in the conversation around what the data means, so that they can, I think that over time, can build trust and garner a greater sense of engagement and possibly even self-efficacy, when you can see that your own voice has contributed to policy action and to change. As a previous, I think a person who posted a question said that the problems are well documented. So being able to demonstrate that action is being taken from the data will also increase trust in these all of these activities, as well as the data collection. And I think in general, it's tempting to be sort of cynical right now around trust and trust between the general public and policymakers, but continuing to just trust on a very human level that the human experience, that families' experiences are real and undeniable and worth documenting and worth lifting up is really critical to building and maintaining trust.
And if I could just pick up on, Christy, something you said, and just emphasize that is, people seeing themselves, feeling like they're reflected in the data, I think is really critical to that. And, a piece of that is asking communities, whether it's parents or, educators or other community members, like what questions should we be asking about you, right? What do you want people to know about you as an early educator? I think that's where I know I've gotten, I think some of my richest research questions are from educators themselves saying, this is what I really want people to know, or I wish they understood, or is this just me and my community, or is this happening elsewhere? Can you help me answer, know that and answer this question? And then having um, that feedback loop of like, oh, I really see myself reflected. This is familiar to me, is really important, I think, in that trust in what you're putting forward.
Great. And we had one more come in that was curious about your thoughts on how you've seen quality factored into the calculus of both practice and policy decisions. Eli, that might be one for you.
Yeah, that's a great question. I'm definitely totally not prepared to answer it, but happy to take that back. And I know my email will be on the slide. I'm just trying to think. I'm like going through my notes here. I also just have so many notes from my co-presenters today, which is fantastic. I feel like I learned so much. But yeah, happy to take some thought into that and get a well thought out answer back on that question, but would also turn to either Christy or Leah if they have any thoughts.
I can jump in here. I mean, I think that it gets a little tricky, and I feel like sometimes around the question of quality, where we end up spinning in circles and chasing something because um, we don't have the conditions for everybody to be thriving, right? And so we sometimes get this question of like, well, we've made these investments, but we're not seeing, this outcome or that outcome. And that's not entirely surprising, right? Because we fundamentally haven't changed how people work and their working conditions as early educators, their economic well-being. We haven't, in most cases, fundamentally changed, access across the board, right? So we might see pockets of change or outcomes that someone's looking for on a particular, like did an assessment move, or what percentage has retention changed. But fundamentally, if we haven't reformed the system it's really hard to comprehensively, respond to questions about quality. And I think part of that is incumbent upon many of us in the sector to raise those conversations with decision makers and policy leaders who are to help them understand this. And I mentioned Massachusetts earlier. I think that's something that they have done really, really well, is that they have helped their leaders understand that this big investment they just made is a contribution to where they're going. And it's not the thing that is it, right? They haven't totally checked the box.
Well, we are coming, unfortunately, to the end of our time together. So I think we're going to wrap up and share a few resources. But I did want to just thank you all again and just some of the key themes that we heard from you guys in terms of really sort of not only making data public, accessible, but easy to use and tied to key policy questions and responses that we're looking for. And I think those are kind of key areas that we can all work on as a collaborative to move forward, and as helpful reminders as we're making sure that we're not only collecting the right data, but it's getting in the right hands so that it can be used in the right ways. So thank you guys. We're going to switch back to my slides briefly. I'm going to run through some sort of next steps. So as I mentioned before, I just want to thank again all of our presenters for the insights that you shared, and as well as everybody who submitted questions. Our goal is to continue this conversation, and I just want to share some resources that we have at the Early Childhood Data Collaborative, specifically on building data capacity, as well as additional connection opportunities in the future. So just some of the resources that we focus on at ECDC. We develop frameworks around like the 10 fundamentals of coordinating your early childhood data. So this just focuses on components such as governance, privacy policies, transparency, and sharing data, as well as specific data to collect that are important as people are thinking to build their data capacity. Our more recent step forward with data framework is developed to help leaders understand and use data better to understand children and families' experiences of early childhood systems. It provides questions, indicators, and metrics that are desired to examine equity, access, participation, quality, and outcomes, a lot of the key data elements that we've talked about today. We have another webinar that's going to be upcoming in September that we'll be sharing through our listserv and our LinkedIn, that's going to feature different state leaders that have been utilizing our STEP framework to help strengthen their data coordination and collection efforts to answer questions about their systems. I just want to remind folks that a recording of this webinar, as well as all the materials I've just referenced, will be available on our website as well. For folks that have questions around data coordination and supports and policies and examples, we do have some technical assistance available through the Gates Foundation that includes consultation, review, support around governance plan, data integration strategies, workforce data collection, as well as efforts to help facilitate conversations and share work that's happening in different states such as these. And then we have on our website and available some practical planning tools and templates that folks can use. We have some light touch kind of research and data support. If you have any questions about this or any other resources, you can email us those at preKdata@childtrends.org. And then I also just wanted to note that in addition to the Early Childhood Data Collaborative, we focus in on, as I mentioned, early childhood data collection and systems and coordination. We also house 2 other early childhood centers and initiatives that provide resources that you can access on early childhood workforce supports, as well as family experiences. We have the National Early Care Education Workforce Center that houses research and resources on strengthening and supporting the early childhood workforce. And then our newest center, the EEC Access Center, focuses on understanding families' perspectives and experiences related to childcare access, including tools for assessing how closely childcare options align with families' needs and preferences for different types of care arrangements. So sort of together with ECDC, all of these efforts are really to support and advance work that's happening in communities to strengthen early childhood systems through data, research, and practical tools to support decision making. For those of you who were on the call that want to reach out to any of our speakers, we have their contact information here. And we will be sharing a copy of the slides as well as all of the resources that our speakers have highlighted today. And that'll be sent out to everyone who registered for the webinar. I know that was quick, but I just want to thank you, the speakers again, and everyone who attended. We really look forward to continuing this conversation with you. Thank you.